Welcome to my channel. Subscribe or like if you like it. Today we are going to explain the active principle Dicycloverine, dicyclomine. We will talk about its side effects, its dosage, contraindications, warnings, its mechanism of action, pregnancy, lactation and much more. What is Dicycloverine, dicyclomine, and what is Dicycloverine, dicyclomine? 4. Dicycloverine, or dicyclomine, is a medicine used to treat spasm of the smooth muscle of the gastrointestinal tract that occurs in disorders such as ulcerative colitis and irritable bowel syndrome. Dicycloverine mechanism of action. Animal studies indicate that this action is achieved by two mechanisms, a specific anticholinergic effect and a direct effect on smooth muscle. Therapeutic indications of Dicycloverine. Treatment of functional disorders of the gastrointestinal tract in which there is spasm of the smooth muscles, such as irritable bowel, mucus colitis, spastic bowel, irritable bowel syndrome, and spastic constipation. Complementary treatment in organic gastrointestinal disorders. To relieve smooth muscle spasm, as occurs in colitis, diverticulitis, regional enteritis, gastritis, and peptic ulcer. Dicycloverine dosage. Oral. The dosage should be adjusted to the individual needs of each patient. Adults, 10 to 40 mg of dicycloverine 3 to 4 times a day. Dicycloverine 160 mg daily should not be exceeded. Side effects and adverse reactions of dicycloverine. Dry mouth, thirst may occur in susceptible individuals. Fatigue, sedation, blurred vision. Eruptions, constipation, anorexia, nausea, vomiting. Headaches, psychotic episodes, and dysuria. Dicycloverine contraindications. Idiosyncratic known to dicycloverine hydrochloride. It should not be used in patients with obstructive uropathy of the gastrointestinal tract, paralytic ileus, atony, intestinal, severe ulcerative colitis and myasthenia gravis. Children under 12 years old. Pregnancy and dicycloverine. Epidemiological studies in pregnant women with products containing dicycloverine hydrochloride, at doses up to 40 mg per day, have not shown that dicycloverine increases the risk of fetal abnormalities if administered during the first trimester of pregnancy. The risk of teratogenicity cannot be excluded with absolute certainty for any product. The drug should be used during pregnancy only when clearly indicated therapeutically. Lactation and dicycloverine. It is not known whether dicycloverine hydrochloride is excreted in human milk. As with other drugs, all warnings and precautions should be taken while breastfeeding. Dicycloverine warnings and precautions. Dicycloverine hydrochloride is contraindicated in children 12 years of age or younger. Products containing dicycloverine hydrochloride should be used with caution in any patient with glaucoma or prostatic hypertrophy. Do not exceed 80 mg per day in such patients. It should be used with caution in patients with hiatal hernia associated with reflux esophagitis because anticholinergic medications can aggravate this condition. Dicycloverine interactions. Amantadine. Class 1 antiarrhythmic drugs or agents. Antihistamines. Antipsychotic medications. Benzodiazepines. MAOI. Narcotic pain relievers. Nitrates and nitrites. Sympathomimetic agents. Tricyclic antidepressants. Anticholinergics antagonize the effects of glaucoma medications. Anticholinergic medications in the presence of increased intraocular pressure can be risky when taken concomitantly with medications such as corticosteroids. Anticholinergics can affect the gastrointestinal absorption of various medications such as digoxin, which can result in an elevated serum concentration of the same. Antacids can interfere with the absorption of anticholinergics, therefore, simultaneous use with these drugs should be avoided. Medications used to treat achlorhydria and those used for gastric secretion tests can inhibit the effects of anticholinergics on the secretion of hydrochloric acid in the stomach. Anticholinergic drugs can antagonize the effects of drugs that alter gastrointestinal motility, such as metoclopramide.